To follow up your question for Lori, do you track the calls to poison control?
Absolutely. The Poison Center does track calls regarding marijuana, both at the national level at the American Association of Poison Centers. We also track it at the Northern New England Poison Center. It's a little bit challenging for me to talk about marijuana because, of course, since we represent Maine, New Hampshire, and Vermont, Maine and Vermont have both legalized recreational marijuana. The good news is that as a toxin, marijuana is not that toxic. That is, even when kids get into it, little children get into the edibles, they are not likely to die. They may have a very unpleasant experience, but they're not likely to die because it is not inherently that toxic. On the other hand, when we talk about the edibles in particular, the dosing can be a problem. So, for example, a brownie may say, the instructions on a brownie, all of the edibles have to be segmented into doses. So if you've got a pack of 10 gummy bears, each one can only have up to 5 milligrams of THC. Or if you've got a chocolate bar, it has to be segmented into 10 pieces so that you can break off a piece. And it will recommend you say, you eat perhaps a quarter of this brownie and then wait 45 minutes to see if it takes effect. Because it takes longer for it to get into your bloodstream when you're ingesting it, that is digesting it, than something you're smoking that goes right into your bloodstream. Now, I don't know about you, but I find eating a quarter of a brownie and waiting 45 minutes quite challenging. That's just me, and I'm a grown-up who should have some restraint. Certainly if you're a kid and you see a cookie that looks like a cookie and is not wrapped like medicine or stored like medicine, it's a lot more tempting to eat the entire cookie. And we've seen adults who ate a quarter of the brownie, waited 10 minutes, didn't see any effect, ate the rest of the brownie, and then because they were new users or naive users, they had a rather unpleasant experience. That's fine. So that's one of the problems that we see. Again, not lethal. The rules for packaging, because if you're taking it as medicine, clearly smoking something for medicinal purposes is really not the best way of taking it because smoking something has its downside. So the the edibles are very popular. New Hampshire's requirements say they have to be in opaque packaging, they have to be labeled with all of the medical sort of information that she showed on her slide, and they have to have child-resistant packaging. That, at most 4-year-olds can get through my safety deposit box, let alone resistant packaging. So there's an attempt to not make it quite as appealing looking as, a display of candies. But you go online and search edibles, and you'll find these beautiful gourmet chocolate sites, and they'll have codes to tell you which ones are nut-free, which ones are vegan, which ones are gluten-free, which ones are sustainably raised. I mean, all of the things that we look for in specialty foods. And there is still a trend to do things like goldfish crackers and Pop-Tarts and Kif Kats and, yes, a lot of cutesy names that make it sound like it should be fun. But for the most part, we're seeing that sort of shift a little bit as the government imposes controls on it now. It's the danger of this becoming big tobacco and becoming such a huge financial endeavor on the part of the state of New Hampshire, because as we've seen in other states that have done, Colorado calls it retail marijuana. They don't even call it recreational. They call it retail. Oh dear God, no. Because it has been such a huge windfall for tax income. And this is New Hampshire. We are always looking for sources of revenue. If there's an opportunity to put a sin tax on it, that's very tempting for our legislature.
However, the states that have legalized and have this increase in revenue, there's also increased costs that come
Absolutely.
with legalizing the product. Especially when we see drug driving and no test yet for that. Healthcare issues that we talked about.
Treatment programs.
Even treatment programs.
Right.
We're seeing skyrocketing rates of, inpatient for marijuana. There's a revenue, that could come in, but there's also an increased cost. And remember, this is a state with an alcohol fund since 2003 that was only fully funded 1 year. And so the idea that money will go for prevention, treatment, and recovery hasn't happened with the alcohol fund, and in many of these states that have legalized, it's often shifted into other parts of the budget.
And
so
we're-
I caution
right.
as far as it's a huge windfall.
And we're already looking at a dearth of capacity to treat our opioid addiction, our epidemic that we've been having. So we're 48th in the country as far as capacity for treatment programs. Adding another substance to that mix. And we also talk about, it's not a gateway drug, but people who have moved on to other drugs will, while not everyone who smokes marijuana moves on to other drugs, people who have moved on to other drugs will likely tell you that they did smoke marijuana. And while it's an illegal substance, you're entering a marketplace. If your kid knows where they can get marijuana, they'll know where they can get other substances as well. I go into Target and can't come out without 12 throw pillows. It's that kind of opportunity, I think, you know. So so there's certainly downsides to the whole idea of legalizing it. So.
And again, it speaks to that increased access, increased use.
Yeah.
I had asked you, we work with a few veterinarian clinics, and they are getting increased calls for pet poisonings.
Oh, yeah.
So while people may not think about their young people or the young people in the community, there are a lot of people who are very connected to their pets and making sure they understand that that's left alone. I know if you put something on the counter, some dogs will jump up on the counter and get it if it's something that's tasty
Right.
for them. And they're seeing that a lot with the pets and marijuana products
Well,
in
especially-
our community where it's not even legalized yet. So.
Well, especially when you're talking about older adults, because first of all, older adults are more likely to have many of the conditions for which medical marijuana is appropriate. They're also likely to not have a big stigma about it depending on their age, because in their youth it was a fairly popular substance, and so there's no real stigma against smoking marijuana. Plus, they're likely retired, so they don't have to worry about drug testing in the workplace either. So we have seen an uptick in older adults in marijuana, and because they don't have children in the home on a regular basis, they are not storing these medicines up high and away. They're storing them where the dog can get a hold of them. So it's those kinds of social issues that we really didn't anticipate, but who knew, you know?
We could go on and on talking about this because it's a very vast subject with lots of things that people don't necessarily think of or understand. Our young people who are involved in the coalition are very passionate about this. They have a loud voice. They've shared it with New Futures. They've written. They've done videos. This is something that they're concerned about because of the high THC. We had a meeting today and we were talking, and we said that we thought it was 96 to 98%, and so we're pretty close to it. But they know of products that are here in this community that have those high THC levels, and so they're concerned about it. We know the vaping is an issue here in the school, in the community. It's easy to hide. Laurie mentioned that you ingest it, there's no smoke that comes out when you vape. I mean, they can ingest it and not even have a way for anybody, the teachers, the kids are talking about, it's happening in the classrooms, it's happening on the buses. I mean, this is a very discreet product that can cause a lot of harm and addiction for a very long time.
And I mean, it smells, the fruity smells, etc. The teacher have their back turned and they'll take a quick puff on their vape and it just dissipates. And it smells like half of the colognes my daughter brings home from Victoria's Secret. You know, it's fruit salad. It's just there's not the telltale signs of cigarette smoking that used to at least be a clue to parents.
Right.
So.
As with anything the coalition does, when we provide information on what to be aware of, we also want to make sure we provide information on resources to deal with these things. And we're very fortunate here in Raymond to have two amazing young ladies who are working with the young people here in the school district. Miss Angela Fallon is a social worker here at the high school, and Miss Gina Simone, right, is at the high school and the middle school as a student assistance person. I'm going to let both of them tell about the services they offer and how you can utilize them, contact them if you're a student or an adult, how you can get in touch with them. So, go ahead.
Again, I'm Gina Simone. So I work at the high school 3 days a week and the middle school twice a week. I do individual counseling with the students as well as group counseling. And I try to bring initiatives and new activities into the school to educate staff, to educate the students about drug and alcohol use. my program as student assistance counselor, also it's more about healthy living and healthy choices. So it's not necessarily just drug and alcohol. I mean, anything can be prevention for drug and alcohol. So it's really trying to incorporate healthy lifestyle choices and educating children on that.
So again, my name is Angela Fallon. I've been here since January of 2014. I'm only here part-time. I'm here 2 days a week just at the high school on Mondays and Wednesdays. Most people get in contact with me through email or teacher referral or through their guidance counselor. I've had some parent referrals, but that's not often the case. I have lots of students refer themselves as well. I do mostly individual and group work with students. I also work with families too, so I work with parents. I specifically work with the Raymond Alternative Program, the REAP program. So I'm connected with all of those students and their families as well. And yeah, I guess that's all I would say.
So we had a great conversation today with some students in the building, and we were talking about both of these ladies, and we just want to make sure that people are aware of the services that they offer and how to contact them. That any referral made to them is confidential. So in the past, I've had people call our office, the Raymond Coalition for Youth, saying they have a situation, they're concerned with their own child or they're concerned with their child's friend. Any situation like that, how do they access help? I will call one of the two of them, and my information will be relayed to them, or I will tell that person who called me to contact one of them. I'm done at that point. No information comes back to me that's in their hands, and they take care of the situation. They connect with the young person, and they try to move forward from there. But the point is, we've had people who can interact with the young people who are in need of services, and that's a very important thing that we want to make sure everybody knows about that, because we want to utilize you. Yes. We know there's a need here in the building. We know there's a need here in the community, so we have them. Let's use them. So would they call the school to get in touch with you?
Yep.
The high school?
Yeah, our numbers are on the district page
Okay.
as well, so you can find it there. Yeah, phone number, email.
Yeah.
Yeah.
So the high school is 895-6616?
Yep.
Right?
And I have an extension, it's 2110.
110?
Honestly, the best way to find me is by email, because I'll be at both schools on any given day, so it's not specific.
And because I'm only here 2 days, email is the best way for me too, since I may not check my email every day.
And then, of course, you can contact our coalition office, which is 895-7061, and I can get you in touch with both of them as well. Another service, the coalition has a lot of information on our website, which is rcfy.org. We have access to prevention materials, treatment and recovery services, and we also have Karen Morton-Clark with us this evening. Karen is an amazing resource with Granite Pathways. The coalition is really about connecting the dots and bringing resources into the community, knowing where to go, who to go to, and how to get those services here in the community for people who need them to access them. Karen is with Granite Pathways and is here on Tuesdays at the Raymond Baptist Church all day long, and she's also can be reached through the New Hampshire Addiction Crisis Hotline, which is
1-844-711-HELP.
Thank you. We have those on our cards and on our website as well. That's available 24/7. We want everybody to know that they're not alone with these issues. There are many people in many communities struggling with substance misuse or addiction, and it's okay to ask for help, and there are people who care and want to help. So that's really the message that we want to drive home, that we care, we want to help you. If you need help, it's a safe place to ask for help. So, and with all of the information we've learned tonight, we know that there are young people and community at whole is struggling with these issues and is constantly getting new things thrown at them. So,
One other resource I would mention is the Partnership for Drug-Free NH website.
yes.
It has a lot of good information about how to talk to your kids at every age about different substances.
Mm-hmm.
And it also has some good peer-to-peer material. It has some other resources listed, and it also has information on the different community agencies that are doing this work at the grassroots level. So I'm on the board, I have to say that.
Well, that's good. I knew that. So, does anybody have any quick questions? We have a couple minutes left. One quick question?
I always Big Tobacco suffered from lawsuits way back when.
Mm-hmm.
What can you say about lawsuits that may be coming with regard to marijuana? it just seems like it's trying for the same kind of situation we went through several years back.
So the advantage that I think tobacco, the disadvantage that tobacco had is that they were already a legitimate industry for many years selling a specific product and able to do research. There's only been 4 strains of marijuana that have been available for research purposes, and they are basically the ragweed of marijuana. They're absolutely horrible strains, very old strains available at the University of Maryland for research purposes because marijuana has been listed as a Class 1 drug, a very dangerous, addictive drug. So there hasn't been the opportunity to do research, therefore, to know what the true evils and dangers of it are, which is what the tobacco companies basically lost because of. They knew the dangers and they continued to sell their product. Marijuana doesn't have that that research body. Now we're doing there's lots of research being done now because there are all these different strains available, and we're still trying to figure out what its legitimate medical purposes might be versus what its claimed purposes might be. So I don't, it's hard to obviously anticipate what we'll find that marijuana use causes down the road, but it'll be hard to claim that the marijuana business industry as a whole knew about that beforehand. So they don't likely face that kind of threat.
Yeah, I think with any public health experiment, I mean, all of what we learned from cigarettes was really like 50, 60 years before it was very,
Right.
concrete. And so with marijuana, it's been legal in the state of Colorado for 5 years, which is really nothing compared to what we know from, how long it takes to really understand. And I totally agree. Because it is legal at the federal level, there's a lot of issues with that, including the fact that it is not researched and we don't know a lot about it. I would argue a little bit that I do think there's an industry that is very clear that they know it's addictive. They have concerns about it themselves with their own family members. A couple people have been quoted to saying that. However, I think there's a difference with what we do already know about the clear research on tobacco.
Plus, we know that addiction has a variety of factors to it. So there are some chemicals like nicotine that will be addictive will cause addiction to almost anyone who uses that product. There are other substances like alcohol for whom some people will have the first sip of alcohol, hate it, never drink it again. Some people will have their first sip of alcohol and decide, okay, and they'll drink socially but never develop a dependence on it. Other people will develop a dependence on it, whether it's a genetic or an environmental influence, whatever that might be. So there are some concerns about the addictive qualities of marijuana as a substance. That, again, the jury is still up and down about that. There are some that are very strong influences that say it is an addictive substance. But we have seen from recreational use that there are those people that will use it recreationally. There are those people that will become addicted to it. So it's, it's sort of a mixed bag.
So the overall ending thing to leave with is we need to give our young people and community members positive things to engage in, positive ways to reduce stress, positive ways to interact in the community without ever thinking that they need any of the substances that we talked about tonight. That's the overarching goal of all of the work that we do as a coalition. So